At Harvard Medical School. So, doctor, let's talk about herd immunity. How would reaching herd immunity affect everyday life? And based on our current rate of vaccinations, do you think we are going to get there? And if so, when?
Great question, Joe. You know, herd immunity was something that we really focused on early in the pandemic as a goal, but increasingly now it seems somewhat unattainable. Even though 50% of U.S. adults have had at least one shot, which is fantastic news, about 30% of the country of U.S. adults is still vaccine hesitant. And the quickest way and the most efficient path to herd immunity is through vaccinations. So we have to do more about vaccine equity, vaccine education, meeting people where they are, and building trust and confidence in the vaccination process to ultimately reach herd immunity.
And we just heard more about that from Heidi Prisbilla about the troubles officials are having with filling vaccine appointments, especially in those rural areas. What can doctors and public health officials do to try to change that?
Yeah, it's really got to be an all hands on deck effort. Vaccine hesitancy across the board has decreased, which is a very promising sign. Though rural areas and poorer areas of the country have the highest rates of vaccine hesitancy. States in the West, like Wyoming, North Dakota, and Idaho, have high rates of vaccine hesitancy, just like states in the South. Mississippi, Tennessee really bring people vaccines like the FEMA initiatives and others across the country and boost that sense of trust, confidence, and get people vaccinated, which is really the main goal at this time. You know, Andy Slavitt said that there are vaccine sites within 5 miles of every American. And that's what he had said last week. So let's try to get all of those Americans to those sites or bring the sites to them to make sure that they're vaccinated.
And Dr. Nerurkar, one thing that would help is the Johnson & Johnson vaccine. The CDC is expected to meet later this week to discuss the future of the J&J one dose. Europe's top regulator says the benefits of the vaccine outweigh the risks of a blood clot. Do you think the CDC could make the same call? And if it does, what would that mean for the rollout?
Yeah, we are all very eager, Joe, to see what the CDC has to say. April 23rd is when they meet, and we will have a determination fairly soon. So in Europe, there is a warning saying that this is a rare side effect, but that the benefits outweigh the risks. We're hoping for something similar here in the U.S. I find it to be very unlikely that we will stop the Johnson & Johnson vaccine here in the U.S. altogether, but we may have some restrictions, like age restrictions in Europe. People over the age of 50 or 60 are eligible for the Johnson & Johnson vaccine. We may see that here in the U.S. I do think that having another option like a Johnson & Johnson vaccine, in addition to Pfizer and Moderna, is really the way to go.
We'll see if we find out more on Friday. Dr. Nerurkar, thank you so much as always.
Thanks, Joe.